This is Bishop Dr. Truman Burst. Master Herbalist, coming to you from Good Shepherd Ministries.
Thank you for joining us here on Discoveries in Health, where we praise the Most High and give the glory to God, and we ahaya, and we talk about natural remedies, and we're getting lots of wonderful results, because when you give the glory to the Most High, anything that you're doing, it's going to work better. It's going to work. When you don't, that's how it works for me, is the things work better. And I just wanted to share that with you, and continue to update some things. And let's go to Google, back over here to don't see that is working. All right, and I think that we've got most of the people here. A lot of people don't know that this conference, where we're talking about natural remedies, and it is a discussion, and you can press the star key 2 times if you have a question, or you want to make a comment or give a testimony. All you have to do is press the star key 2 times and ask that question or make that comment. That's all we have to do. Press the star key 2 times, and we'll get a topic, a question, or a comment. Go ahead.
I have a question.
And what is that, please?
What is good for jittery or nervous legs, mostly at the nighttime? Happens during the day, but it seems mostly at night is the worst.
Yeah, that's called restless leg syndrome. And are you taking any calcium and magnesium?
I do.
Are you taking it at bedtime?
Yes.
Okay. Can you tell me what the dosage is with that calcium and magnesium?
I do a tablespoon of warm pepper. Listen.
So you're taking a tablespoon of magnesium. Is that right?
Magnesium powder in hot warm water, and I drink that, and I also take the magnesium tablet.
So you're taking a lot of magnesium. How about calcium? Are you getting any calcium?
Yeah, that's what I said. I take a tablespoon of calcium powder in warm water, and then I take a magnesium tablet with it.
Well, it sounds like you're getting plenty of calcium and magnesium. For some reason or another, you're not assimilating it. I don't really know what that tablespoon dosage is. I don't know whether it's 1,200 milligrams or 2,000 milligrams. Sounds like quite a bit, but it doesn't sound like you're really absorbing or getting it. Maybe you need to go to a more high-tech, multiply chelated calcium magnesium, and taking. Yes, Doc Miles, are you there?
Yes, sir. Let me interject something here.
Wonderful.
No matter how much calcium that you take, you're not going to absorb it unless you have hydrochloric acid. And everybody, even teenagers today, are not getting enough hydrochloric acid. So they have to take a hydrochloric acid capsule before each meal. I don't care how much calcium you take, it's not going to cross the barrier and get into the system to break down the calcium to go to the bones and teeth. I see this every day, even with teenagers. That's
All
why
right.
you have acid reflux.
Okay.
And it works Every time I've done it for years and years and years, and I promise you, that's the key. Hydrochloric acid capsule before each meal. It breaks down your calcium to go to your bones and teeth. It breaks down the protein to go to your heart, your muscle tissue, and your hair, because your hair is 95% protein. If your hair is coming out when you brush your hair, you're not getting the protein that you ingest. I don't care how much protein you eat, you've got to have the hydrochloric acid to be the carrier to break it down so the body can assimilate it. So that's the key. I'm sorry I didn't mean to interrupt, but that's just.
I'm glad you interrupted.
That's right. That's what, and that's why we asked Doc Miles to join us here, is because he's very knowledgeable. He's very highly experienced, and that's great advice. So that HCl, where can they get that HCl, Doc Miles? Can you give us your?
They can call my office, and I ship it out every day. I ship it all over the country. I mean, it's not expensive at all. If you have a gallbladder, then I have one. If you don't have a gallbladder, I have a different one that has ox bile extract in it to break down the fats. Because that's what the gallbladder does. So I have two different types, and I have to ask if they have a gallbladder or they don't have a gallbladder before I send it out, because I want to make sure they get the right one.
All right. So what's a good time to call your office? Because I've had difficulty getting to you.
Well, my phone's been ringing off the wall, so just, keep trying, or if you leave a message, like if you call tonight, nobody is there, so you leave a message with your name and your phone number that you heard me on the show and you need some hydrochloric acid, and we'll call you back and get all the necessary things we need to send it to you, your address and all that kind of stuff. So
at a 30-day supply?
Right. It comes 90 in a capsule. 90 capsules in a bottle, and it's $18, so it's cheap. And you take one before each meal, so the hydrochloric acid will be in the stomach lining when you ingest your calcium and protein foods.
Oh, I'm getting a little bit of echoes here. I'm going to have to close out some mics. Thank you for understanding that sometimes the microphones become open and then we get echoes, and I have to keep closing them out. So let's give folks that telephone number, Doc, because some people don't have it. What is that telephone number? Are you with me, Doc?
Can you hear me now?
I can hear you now. What is that telephone number?
512
518
9867.
9867. I've got
868 9867.
I've got 512-868-9867. Is that right?
That's correct.
Okay. Well, folks, that is the number to talk with Doc Miles. And I'm going to have to close out another microphone or two here. I see that it got open here again. And stay with me while I get rid of the background noise. So we've got a few open microphones. There they go. That was the one. Okay, so for restless leg syndromes, then it's getting that hydrochloric acid, the HCl, get that going and get that digestion going. Then, when you're taking that calcium and magnesium, then you're going to absorb it, and that's what we and that's just what we just talked about. And I'm going back again because I've got open mic somewhere, and I have to keep doing this. And it's in Sacramento. There we go. We closed that microphone, and we got the background noise gone again. And so, one other thing I wanted to talk about, Doc, is I wanted to talk about a product called lipid. It's a natural lipid support, and I have it here up on the screen because I'm doing a screen capture, and I'm looking at that natural lipid support. Comes in 210 10 capsules, and I got an open mic again, and I gotta go close it. It's over there in Georgetown. I got it. Okay, so and I'll go back now and see if I can capture that label again. I'm looking at it. Everybody's looking at the natural lipid support. Tell me about that, please. Doc Miles, are you with me?
Yeah, I'm here. I'm here.
Okay. So
The natural lipid support is awesome to reduce your cholesterol levels. And it only takes about 90 days to do that, because if you take a statin drug, I've seen a medical study that was done last year, and they don't want to release it to the public because if you take a statin drug, you end up with Alzheimer's. 80% of the people end up with Alzheimer's.
Okay, I just keep having mics that go. All right, so you're having great success with this natural lipid support, and you take 7 capsules daily, and that brings your cholesterol under control. Is that right? I don't know. I kind of keep.
Am I on?
You are on, and I'm keep closing mics because I keep having people with open mics. They're joining us from all over the country and all over the world because this is a international call. So, and we keep having folks joining us, and that's great, and we love it. But the microphones are open, and it causes an echo. So I think that really answers a question. We've just answered 2 questions. One, how to deal with restless leg syndrome, and the other, how to deal with cholesterol when you are looking at that natural lipid support. And you get 210 capsules, and you take 7 capsules every day with meals, and can be taken throughout the day. And then I'm looking at this, and it's got and this is your label, and of course I know that it's all the high quality because it's manufactured by the BetterHealthHerbs.com people, Health and Herbs there in Albany, Oregon, that make all of the products that we're talking about. So if you're interested in any of the products and the services of Doc Miles, please give him a call at 512-868-9867. And his phone is like mine. It's ringing off the hook. And that's good because you know what they say. You never want to go to a restaurant that isn't busy because the food isn't going to be fresh. You never want to go to a doctor who isn't busy because apparently he's not helping anybody and nobody wants to go see him. And the same thing with an herbalist. If he's not busy, he's probably not helping people and not doing any good. So it's kind of the same principle. And I know Doc Miles is a busy fellow. So is there anything else, Doc Miles, that you wanted to share with us, or is there any other topic that you wanted to get into? I guess not. And are you with me? Yes, sir. You are there.
Okay, my mic keeps closing down. Anyway, no, I'm helping a lot of people that's called in on the radio show, and a number of them here in Texas has come to see me, and I'm helping them turn their life around because nobody gives them the knowledge that I give them, because medical doctors, they don't even study 5 minutes of nutrition, so they don't have a clue. If they don't have a drug that'll do something, then they won't. And drugs only put Band-Aids on it anyway. It doesn't fix the problem. It only extends the problem and eases up the symptoms. It doesn't fix the problem.
That's a fact.
Are you there?
I'm with you, and yes, I agree with you, Doc Miles. They and their poison chemicals. Well, they pollute the body, and then they have to give you another one for the effects, and then they have to give you another one for those effects, and it's just not a good thing. So natural remedies is the way to go.
That's right. Every time, because it always works. And what Brittany is making up for me.
Okay, I've got to close the mic. I'm sorry. If that's the, I'm going down here finding it. It's over there in Jacksonville, and I found it and I closed it. Please continue, Doc. I'm sorry. We just have these mics that are open, but yours is the only one open at the moment. Thank you.
Okay. Can you hear me?
By 10 by 10.
Okay. All right. No, Brittany makes up my natural lipid support. She uses the top quality stuff in the whole nation, and everybody I've ever had it made up for before, it worked, but not near as effective as the one that she's making up for me right now. It's amazing.
Yeah, she does a wonderful job. She's really always uses organic ingredients, the highest quality. Yeah, I have absolute faith in the products from BetterHealthHerbs.com, and the fact that they make that natural lipid support. I know that it's high tech, and that's, of course, that's why for many years we've been working together and creating products together. And what has it been? Probably about 25 years or something.
Yeah, something like that.
A long time. So yes.
Time waits on no one. Time just slips right on by.
It sure does. So, folks, if you have a question or a comment or something, maybe you have a question for myself or Doc Miles, now's a good time to press your star key 2 times, and we'll take another caller. No questions at the moment. Okay. That being the case, I'm going to bring this list over here. A lot of people don't know Doc Miles, so I'm going to bring over the list of. Go ahead. Did you have a question or a comment?
Yes, I have a question.
Yes.
Last year, my younger sister had a stroke because she had a mini stroke because she had a hole in her heart. And they end up putting an umbrella in her heart. And I know she was having issues with thick blood. And I want to know what caused that.
One of the things that will help it is vitamin E. It'll thin the blood. About 400 IUs daily. That's one of the things. And then I would go to that herbalhealthreview.com website, herbalhealthreview.com website. I'd click on common conditions. I'm going to do that and show you what I'm talking about because I'm making a video of this broadcast as we speak. And so what I'm looking at, you're looking at. And all of a sudden, this is not coming over. There you go. Come on. It's not going to do it. But if you're on Herbal Health Review, there we go. It came over. And if you're looking at herbalhealthreview.com and you're clicking on common conditions and you go down to the heart report, you're going to get a lot of good ideas about things that are going to help the heart. And let's take a look at that report briefly, because that's what you need to know about. And then I'm sure Doc Miles has got other ideas about heart health and heart support. So I have pulled up that report on herbalhealthreview.com. You can't buy anything on this website. Everything on it is just information. And it's the body of my life's work. It's a culmination of 55 years of research, and it talks about a heart support formula. It talks about a bugle wheat for cardiac arrhythmia. it talks about the fish oils that may reduce ventricular arrhythmia. And it goes on to talk about the value of these oils like fish oils and flaxseed oil. And these are the things that are going to help the heart. And the acetyl L-carnitine to feed the heart muscle. And sea buckthorn seed oil. And again, calcium and magnesium, which is going to it's going to help the heart and the arrhythmia of the heart. Coenzyme Q10, it talks about that and the value of it for heart problems. And red wine complex, that resveratrol. It talks about that. It talks about potassium with iodine in it, golden seal root, and Oregon grape root, and barberry bark, and turmeric root. It talks about all of these herbs and nutrients that help with heart disorders. And it goes on to talk about acidophilus, which works with that low stomach acid, and really helps when there is Helicobacter pylori. So there's all these things that we can do to support the heart. The fish oils, zinc, magnesium, vitamin B6, lots of vitamin C. And if there's a weight problem, there's a complete weight loss report. And if you click on any of these links, and there's a diabetes report, because a lot of times that is related to the heart problems. So all of these things, if they're an issue, a part of the issue, they have to be addressed. You can't ignore them, but at least you can check to see if these are the things. If diabetes is a part of the heart disorder, or if weight loss, or too much weight is a problem, well, then we need to address those issues. If the glands aren't working, well, so we created a gland rejuvenator, and it has a heart formula in it. So there's just lots of support, with the with all these nutrients. So be sure. And if there's clogged arteries, which sounds like if they put an umbrella in the heart, that was the problem, and they're trying to open it up. Well, here is a clogged arteries report. I'm going to click on that clogged because there's reports within reports. Talk about information. And then you can click on any of the products and you can look at them. So it goes in to talk about how to unclog those arteries with a heart support formula, and garlic, and a colon and liver cleansing liquid. And we're talking about Truman's fiber with bentonite clay. All of these nutrients. And by the way, that Truman's fiber with bentonite clay will also lower cholesterol. And there's Google, Guggul, and 3 to 6 grams of Google per day might help lower cholesterol levels. So there are lots of things here that we can do. The HCl, the Google, the Truman's fiber, say goodbye to cholesterol problems. There's horny goat weed that has been used to treat hardening of the arteries. So there's just a lot of turmeric, which is going to help to reduce inflammation in the heart. Ginger is going to help with that platelet count and so forth. Bilberry fruit, like turmeric, is also a blood platelet aggregation, a supplement. And so there is so much information in that heart report that it even has another report in it for clogged arteries. So just knowing that you've got all that information at your fingertips when you go on herbalhealthreview.com and click on those reports. Doc, did you have anything else to share in that area?
Well, the lady that was talking about the hole in the heart, one of the best things for the heart is the CoQ10. a minimum of 200 milligrams a day of CoQ10, by itself, because that's so good for the heart muscle, and it helps, put oxygen in there. There's so many different ways to deal with it. It's, I do the blood chemistry report, and once I see the blood work, I run it through a special program, and it spits out an 18-page report, and it shows every issue that person has based on their blood work. And I'm the only one in Texas that's doing it, and there's, it's crazy because I'm getting people every day that's hearing about it, and they come in, and other people tell other people, and the place is just packed every day. It's just unbelievable. So the CoQ10 is very good for the heart. Go ahead.
Where was your office?
It's in Central Texas, 25 miles north of Austin at Georgetown, Texas.
Okay.
But I have patients in every state, all the way across the United States, and I can do it by mail, email, whatever, fax. Once I get the blood work and run the report, I can look at the report, make changes, call the person and tell them what I see, send the report. We go over the report, then I can send whatever supplements that they might need to, get things turned around. That's the way I do it. And I use a lot of Truman's products because he's got some great products, especially for the blood sugar products and the blood pressure products that he's got in the liquid, because the liquids go right into the bloodstream and go to work. He's got some great products. I mean, that's why I've admired Truman for many, 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 many years, because he knows what he's doing, and he's very, very, very good at it. He's the #1 master herbalist in the whole United States, and I admire his knowledge, because he's really got it together. So I'm really, really pleased to work with him now.
Okay,
Yes.
thank you.
Okay, that leaves lines open. We want to make sure that you have a chance. This is not a lecture. This is a discussion. And if you've got a question or want to know about something, now's a good time. We've got Doc Miles in the room, and let's take advantage of that. So if you have a question or comment, unmute your mic by pressing the star key 2 times and join the conversation. Press the star key 2 times and join the conversation, please. Now.
This is Kimba. Can you hear me?
Yes, I can. Go ahead.
My daughter is trying to find out if this is just in her head or if it really happens physically. But she says every time it starts to rain, her body really hurts. She has a lot of joint pain. Is that a myth, or is there something to that, or is there something in the air that's causing that?
Good question, Doc. What do you think?
Well, it could be any number of things. It depends on whether or not you live close to chemical plants, and that can cause that. But to find out what the real issue is, the only way I can answer that is to see a complete set of blood work, which is your comprehensive metabolic, your full CBC, your lipid levels, your TSH, which is your thyroid stimulating hormone, and a urinalysis. Those 5 elements needs to be in the blood work. It's about a page and a half of blood work, and it's just awesome what I can find out just from those panels, because it addresses all the organs, and it addresses the need for hydrochloric acid, where a person has osmosis, which is the body's inability to break down the nutrients. It just opens up whole new avenues of information that you can't get anywhere else. And that's why I'm so busy, because I'm cranking out this information every day for people. So it would be a hard thing to answer unless I could see some blood work.
Okay, thank you.
Very good answer. Very good answer. Because we need to. There's just a number of factors that one has to make sure that you check and make sure what's going on. And you nailed it right there. That blood work, those reports that you offer to people. Yes. Well, that's why you're so busy. And thank you for joining us, Doc Miles. We love you and appreciate that you're sharing your time with us here today. So, folks, if you have a question or a comment, press the star key 2 times and join us in the discussion. No questions, no comments at the moment. All right, then what I'm going to do is I'm still trying to find that open mic. We've got an open mic somewhere here, and I can't close it in the area code 478. Can't close that mic. It's making a little noise, and for some reason or another, I'm not able to close some of these mics that are open. So there seems to be a little bit of background noise in some of the microphones, but that's the way it goes. What I want to do now is I'm going to bring over into screen capture and let people see the fact that this is a international conference. If you know anyone who is in another country who would like to join us over the telephone or over the computer, they can do that. And so far, I'm not able to get this screen capture to go over there. And I keep trying, but it's not working. So I'm going to see if I can do it like this. I'm going to minimize that, close this one, and come over here and pull that screen capture over there. There we go. Now what we're looking at is the fact that you have all these countries and many more that you can and join this conference. If you're in Argentina, Australia, Austria, Belgium, Brazil, Bulgaria, Canada, Colombia, Croatia, Cyprus, the Czech Republic. We got open mics here, and I've got to go back and try to find them and close them up. My goodness. But anyway, all of these countries, they're all a part of you can join this broadcast. And now I'm going back and looking for that open microphone that is really noisy. Where is it? Discoveries in health. There, is that it? No. There we go. And now I'm looking for that open mic. Sounds like somebody's typing in the background and with an open mic. Okay. They quit typing, but their mic is still open. And I can't close it. I can't close it. I don't know why. But please bear with me. Yes, go ahead.
Dr. Truman,
Go ahead.
I got a question.
Yes, go ahead.
How you doing?
I'll bless your brother. What's your question?
Somebody on dialysis, can anything get done to help them?
Somebody who's on dialysis. So, yes, I'm going to close your mic because there seems to be a lot of echoes coming out of Atlanta. There it goes, maybe. Okay. Just know that Atlanta, area code 404, I cannot close your microphone, and there's a lot of noise in the background. I got 2 microphones in Atlanta area, and I can't close them. And they're typing in the background, they're making noise in the background, and I cannot close those mics. So just know that I'm trying to close these mics that are noisy. I'm not having much success. Maybe that'll help. Okay, so just know that if you're in the area code 404, your mics are open, I can't close them, and there is a lot of background noise. And I keep getting open microphones, folks. This is really interesting. Okay, so dialysis. I'm trying to get to the topic, but I can't get past all these open microphones and the noise background with the open mics in the area code 404. That microphone finally closed up. Okay, but I've got open mics and I can't close them. In area code 404. Just know that your microphone is open and it's making a lot of noise, and I can't close your microphone in area code 404. Just know that it's just a lot of noise and I can't stop it. So, going over here, let's answer the question. Okay, we left off talking about the fact that this is an international broadcast and it's available all over the world. in Denmark, and in the Dominican Republic, El Salvador, Estonia, Finland, France, Greece, Hong Kong, Hungary, Ireland, Israel, Italy, Malaysia, Mexico, the Netherlands, New Zealand, Norway, Peru, Poland. All these countries are now joining us. Switzerland, the UK. It's a free telephone call to join this broadcast from all over the world. And now, again, trying to close the mic and talk about dialysis. But these microphones are open and they won't close. So I'm going to have to, area code 404 455. I'm having to disconnect you. I can't even do that. Not working. So, and Sacramento, your microphone is open. And now I closed it, so maybe that got rid of some of the noise. They're back open again. I closed the Sacramento microphone, area code 916, and it opened right up again. I'm having really problems here, folks, with trying to keep the noise level down with open microphones and noise in the background. So please know that if your microphone is open, there's a lot of noise in the background and no one else can hear anything. It's just noisy. I'm trying to close out some mics and not having much luck. Stay with me while we try to do this. And because we need to talk about dialysis. And I guess evil is stopping us from talking about dialysis because there are people that are using the herbalhealthreview.com. They're going to that website. So the answer is go to herbalhealthreview.com, click on common conditions. I'm sorry, area code 916. I can hear everything you're saying in the background, and everyone else can too. I cannot mute your microphone. Same thing in Atlanta. I keep pushing the mute button on the microphones, and it's not working. It's just kind of like a bad dream here, folks, because I got open microphones, people making a lot of noise in those open microphones, and no one can hear what's going on. So, and I can't close the mics. I can't delete the mics. It's no fun. And it's Sacramento.
We need to wait till like the first of the month.
What? What's that?
You know how we always do
Say.
Yeah.
Yeah. And then you can go to everybody in Uber. Okay, go into Uber like that, huh? Okay, I'm gonna go into Uber. And see if I can do it from there, folks. Stay with me for a minute while I solve this technical problem of open microphones. I got my technical genius here, and he's helping me, and we're going to go in there now and close out some microphones. Okay, so that we don't have all this noise. We will continue here in just a few minutes. It won't take long. And there we go. I'm going to log in and join the conference. Log in and we'll be closing up these mics here in a minute. I'm going to have to do it another way. And joining the conference. And okay, this might work. Okay, now I'm going to close that. And let's see if we can close that microphone. That's working. Oh my goodness. We found it. We found a fix. Oh, all right. Okay. That was that. My goodness, it worked. Okay. But now somebody just opened their mic after I closed it. Nope, I think we got it. Woo! My goodness. All right. We have closed out, except for Atlanta here. All right, now We have been able to close the mics. We had to open it up in a separate window. Gee, my goodness. All right, now I'm going over here into Discoveries in Health. And I'm clicking on Common Conditions. And I'm about to bring up the kidney dialysis answer because we've done this many times. Not everyone can come off of dialysis, but most people can come off of a dialysis machine when, that's what they tell me anyway. I can only report what I hear. I'm not prescribing or diagnosing. We don't promise cures here. We just talk about the natural remedy research and what people tell us. We're just reporting it. And what people are reporting to me is that they're coming off of dialysis machines when they use this kidney bladder report that I am now pulling over and dropping into the window if I can. Okay. And let's see if I can do that. It doesn't want me to do that. I got too much in there at the moment. So be it. You gonna let me in? No, it's not going to do it. So I'm going to minimize this and go grab that kidney bladder report. Now you're looking at, or will be, now you are. You see, I'm making a video of this broadcast. And you're going to be able to go to the website, herbalhealthreview.com, herbalhealthreview.com, and click on Common Conditions, and then go to Kidney Bladder Report. And here's how they're doing it. They are making sure they're getting calcium and magnesium in their diet, amino acids, enzymes, potassium, super green foods, organic liquid multiple vitamin called Intramax, and an anemia relief formula called Plasmania that helps the kidneys to excrete waste. And then if you know about pomegranate concentrate, which has antibiotic properties and helps to acidify the urine, and if you're eating a lot of celery or putting celery in the blender and making a celery smoothie with other herbs, such as putting in some so here's a good recipe: pomegranate concentrate, some celery, which works as a diuretic to decrease the uric acid, add some parsley, which works as a diuretic to decrease the uric acid, get some hydrangea that cleanses the urinary tract, and some uva ursi, which has germicidal properties. Blend that all up into the blender. Now you have a real powerful kidney formulation that's going to help nourish those kidneys. And then if you know about that marshmallow root tea, well, that's where you get a quart of water and you bring a quart of water to boil on the stove. And as soon as it comes to a boil, you pull it off the burner and you put a tablespoon of marshmallow root tea, heaping tablespoon, into that quart of marshmallow root tea. You blend it all up. You stir it all up. And after you stir that up a little bit, you put the lid on it and cover it, let it cool down, and drink it throughout the day. And during the day, you're getting some kidney bladder herbal tincture extract that contains peach bark, marshmallow root, buchu leaf, corn silk, echinacea, goldenrod, parsley root, red clover blossoms, dandelion root, watermelon seed, and uva ursi. And that's called kidney bladder drops, number 1246. And you're taking 30 drops of that 3 times a day or more. And if you need a calcium channel blocker, you're going to get some kava kava tincture extract, and you're going to take 30 drops of that 3 times a day, right under the tongue. And you're drinking cup after cup of your 1 quart of marshmallow root tea throughout the day, and taking all these drops. And let's take a look and see where we are. We got an open mic again. Oh, it quieted down. Okay, so and you're getting some drops of Schizandra berry, 30 drops of that 3 times a day. What we're doing is overwhelming the kidneys with nourishment and the ability, if they will, to go back to work again. And it happens. The minimum thing that does happen is that they are strengthened, that the kidneys begin to work a little bit, and then more and more and more, until they're off the dialysis machine, usually. Okay? Schizandra berry. Why? To strengthen the digestive organs and the immune system. It protects against free radical damage and viral and bacterial infections. Schizandra berry, 30 drops of that. And we're going to get some nettle leaf. It contains biologically active compounds that reduce the inflammation. You know, herbs for better health include combinations of some or all of these nutrients in extract form.